What information is available about pregnancy and drug use?
There's information available on health websites, also your GP, antenatal clinics at your maternity hospital. There's also specialist drugs and pregnancy services that you can contact for information. All pregnant women have priority access for methadone maintenance treatment. Most places will also accept their partner into treatment if they are also a heroin user. And this is because it's very difficult to maintain stability if you're around a partner that's still actively using. So most places will allocate you a spot to come on to methadone treatment. For women that are using opioids during their pregnancy, methadone maintenance is the treatment that we'd recommend. And this is because it brings stability into the woman's life. They're getting a steady dose of opioid, and therefore so is the baby, rather than sort of erratic heroin use where levels sort of fluctuate for both the baby and the woman. The woman can experience withdrawal symptoms if she's using heroin, and therefore so can the baby, which can put the baby at risk of becoming early and also being of small birth weight. So methadone adds stability and also the lifestyle factors that go with it.
Buprenorphine isn't licensed for pregnancy, although the available evidence suggests that it's okay for most women to remain on buprenorphine during their pregnancy.
Lots of women will stay on artificially low doses because they think that the greater the dose, the worse the withdrawal in the child. This is not the case. We haven't found any correlation between the dose that the woman's on and also the withdrawal in the child. So with your dose, we encourage you strongly to stay up and be comfortable on the dose that you're on, and don't try and stay low just to avoid withdrawal in the child, because there's no link. Neonatal abstinence syndrome is a bunch of symptoms that we look at in babies to see if they are showing signs of withdrawal. The sort of things that we look at are poor sleeping, poor feeding, irritability, agitation, and combined together they can show us that a baby is suffering symptoms of withdrawal that may need medicating. The treatment for babies that do suffer an opioid withdrawal is an oral solution of morphine. It's a very weak solution, and you will be taught how to draw up and administer that solution to your baby prior to leaving hospital. Also, for women on methadone maintenance treatment, we strongly recommend breastfeeding. A very small amount of your dose in your breast milk goes through to your baby, and research has shown that this can greatly reduce the amount of withdrawal symptoms that your baby will display, and also the amount of medication that your baby may need if it does require medication.
One of the issues I find that a lot of women face is, as they're getting closer to delivery, they're very concerned that they are on methadone. They would prefer to be drug-free naturally when they deliver, and sometimes women believe that they should detox towards the end of that pregnancy. One of the concerns we have with that is when women do detox in a very stressful time of their life, such as a pregnancy, the risk of relapse is fairly high. So certainly from our point of view, we would recommend that you do stay in treatment and stay on methadone. Maybe after the baby's born, if that's still a concern, we can help talk you through some of the treatment options that are available to you then.
It's very important if you're in treatment to stay in treatment and maintain that treatment. One of the things about detoxification is it can be very destabilising, and what we want to see is parents who are stable and able to care for their children. So if you're going to detox, it's important that you talk to your medical practitioner around that, because in those circumstances we want to make sure that children are safe, as you want to make sure children are safe. And so maintaining your treatment and picking the time when it's good for you to detox is really important in consultation with your treating practitioner, your doctor.